Welcome to About Seniors Talk TV. I'm Victor Oliveira, and I'm the president of In Our Care Home Care Services for Seniors and the host of this series. Financial planning is simply not for when you're young and trying to establish ourselves, paying off bills, paying down our mortgage, and setting aside some savings. As we age, our priorities may be different, but we still need to prepare for the future. Financial planning for a comfortable retirement takes some know-how in as far as knowing what the potential costs can be, particularly if your health concerns are present. My next guest is not new to our show, but it felt necessary to bring her back and facilitate a coverage on a very important topic. She's the CEO and co-founder of Silver Sherpa. Silver Sherpa is a lifestyle transitions company delivering specialized planning and coordination, advice to seniors and their families as they move through the challenging transitions. Her credentials in the healthcare sector as well as in the private sector are equally impressive as her determination to help navigate care and financial process. Please welcome back to our show, Susan Hyatt. Welcome back, Susan.
Thank you.
Last time we talked about the importance of seniors planning ahead in order to stay in their village, and we also talked about legal preparation. But you also stressed about financial planning. Why is that so important?
Well, Victor, it's very important for seniors as they age because all of us focus on retirement planning and getting to that magic age of 65. But in fact, as you age now, and these days, if you reach 60, chances are you're going to live to 80. If you're living at 80 right now, there's a very good chance, and if you're in pretty good health, you may well live to 100. So you might retire at 65, but you could have another 30 years of living. And as we age, we sometimes run into healthcare difficulties. And it's at that point that if you haven't planned for the additional costs as you're elderly and perhaps you need more help, that's when the costs start to add up.
So it's not necessarily planning for retirement, but planning so that you don't outlive your savings through your retirement ages.
That's right. And outliving savings could come from any direction. You know, for example, some of the costs in home care, for example, if you needed home care in the home, those costs are around $25 an hour to have a personal support worker. But if you needed someone 24 hours a day to look after you, particularly through a difficult healthcare period, that could add up to thousands of dollars per month. So that's something that we have to factor in and think about. Or another example would be if you had to go into an assisted living community where you needed more nursing help every day. And in an assisted living community, the costs in Ontario, certainly in the Toronto area, the GTA, could be anywhere from $5,000 to $10,000 per month. Those are large numbers, so we need to start thinking about those things before we get into our elder years.
Is it a complicated or a tedious process to go through a financial planning assessment with Silver Sherpa?
Not at all. It's not a difficult process at all because what we do is take the highlights of a financial plan, but it depends on you as an individual and what kinds of challenges you might be looking at. For example, if you're 80 and you've been diagnosed with Parkinson's disease and you want to stay in your home for the next year or two, but then you're thinking maybe in a couple of years I might consider moving to a community where I can get more help, then we help you plan on those goals, plan financially for those goals. And then of course if you have your own financial planner or an investment advisor, we would work with them as well, with your permission.
Okay, so if you're not a healthy person as you reach those age and you're having to access the acute care system, such a hospital, why should we think seriously about having an advocate when we go into a hospital if we can't do it ourselves?
Well, an advocate, if we sit back and think about it, what does an advocate do? And that's the whole purpose around the name Sherpa, because a Sherpa is the person who guides you up the mountain and guides you back down the mountain, and hopefully make sure you don't fall into the ice crevasse on the way down. Same thing with an advocate. An advocate is a person who speaks on your behalf, somebody who's could be a quarterback for you. They have your back. They can ask the tough questions. So when you're in an acute healthcare situation or in a hospital, it's a pretty frightening place sometimes if you don't have a healthcare background. And sometimes you just need someone there to help you, to be your champion, to be your spokesperson, to ask the tough questions. And if you're uneasy about something the doctors are telling you or something about your care, that advocate can help you ask the right questions and also even ask for a second opinion. And you might not feel comfortable doing that yourself.
So when you're serving as an advocate, are you replacing family members or augmenting to family efforts?
Absolutely not. We're augmenting the efforts. We're the person behind the scenes that can meet with the family, work through all those challenging circumstances, translate some of the language, because doctors and nurses speak sometimes in code that we don't understand, and help with the family and the senior to really decide, are these the right things that we want to do? What about other ideas? Perhaps they have questions and we can help them ask those questions in a timely and a reasonable way.
So typically the people who are approaching Silver Sherpa, would it be the senior themselves, or would it be their children who is trying to advocate on behalf of mom and dad as well?
It can be either, really, Victor. The senior themselves, sometimes, they may call us and they might say, I don't want to bother my children, or I don't want my children involved. I want you to work with me directly. At other times, it's the adult children. Most often, the adult children who are boomers, probably themselves, and in the sandwich generation, where they're getting squeezed between looking after their teenage children or children who have come home to live. They've got their own careers and their own busy families, and now they have elderly parents who are not well or running into some difficulties later in life.
Okay. The last time we spoke, we had a meeting in your office, and we talked about especially the practice of seniors who are living with adult children. And perhaps challenging situations, and the variables are endless. But can you give us a few examples of some of those living arrangements and how they could benefit from contacting Silver Sherpa and help you navigate their process?
Yes, and I'm glad that you raised that, because, Victor, it's a topic that seniors are embarrassed about often. They don't want to talk about sometimes, and it's a relief for them to be able to talk to us. We think about 20% of seniors, somewhere around that number. It's hard to get the actual numbers, but we think about 20% of seniors are either living with an adult child in their home who has special needs, because we know special needs are about 13% of the population, or they're living with an adult child who has moved back, and we often see substance abuse issues. So perhaps a child has chronic alcoholism, or they're not really a child, they're an adult, but they've moved back home with mom and dad under the auspices of taking care of mom and dad. But in actual fact, sometimes what happens is the adult child starts to take advantage of mom and dad, either free room and board. In some cases, we've seen adult children, particularly with substance abuse issues, asking mom and dad for money that's inappropriate. We've been called by the other adult children to say, my sister or my brother has moved back home. They're taking money from mom and dad. Mom and dad don't know what to do. So that can be a recipe for some really serious issues. Okay.
Now, we only have a minute and a half left, but I wanted you to talk to us and educate our viewers. You also facilitate or intervene when a client is being discharged from the hospital, perhaps untimely, and how do you help navigate that process?
Well, as you know, the hospitals in Ontario have what they call a home first policy. And we're in a bit of a squeeze in the healthcare system because the acute care hospitals are for acute care. And when mom or dad are in hospital and they become medically stable, often there's pressure to discharge them. But if they're being discharged home, home first means they come home. Mm-hmm. And if mom and dad can't live alone because of their illness, then they come to live with you. And that cascades a whole bunch of dominoes that start falling. So we're often asked by sometimes the social workers, sometimes the discharge planners, sometimes the doctors, the families, or the seniors themselves to come and help that transition and that discharge.
Unfortunately, I know that all too well. Would you like to remind our viewers how they can get a hold of you?
Yes, absolutely. Thank you. They can reach us on our website at silversherpa.net, or they can call us at the office 905-491-6972.
Thank you so much, Susan.
Thank you, Victor.
We'll be back in a few minutes. Welcome back to About Seniors Talk TV. We seem to talk a lot about planning. Planning is a process of preparedness, and it's always best to be prepared rather than be taken by surprise. It makes us better equipped to handle challenges with control rather than panic. Panic makes us think irrational. A plan helps us make decisions thoroughly, thoughtfully, and practically. Our next guest knows all about planning. She's the manager for the Office of Emergency Management in Mississauga since October 2014 and led the Office of Emergency Planning for the 2015 Pan Am and Para-Pan Am Games, as well as the upcoming 2016 Ontario Summer Games. She also serves on the Board of Directors for the Safe City Mississauga. She's a former Executive Director of Safe City, leading the city's crime prevention services, including programs like Neighborhood Watch, Crossroads, Youth Academy, Counteract, and Aspire. She's worked closely with the regional police and the employees of City Mississauga, province and federal governments. She's also was the executive director of Nature Coast Emergency Medical Foundation in Florida and the chief emergency medical services for Monroe County, Florida. Working closely with the Office of Emergency Management to prepare emergency plans, operating procedures, and designing exercises to ensure training and sufficient successful emergency operations. And she's worked on average of 5 municipal emergencies from the years 1992 to 2006. She's also a former United States Navy from 1985 to 91, worked in the intelligence, and she's a decorated veteran with the Navy Achievement Medals. Welcome to our show, Teresa.
Thank
that
you.
was a mouthful.
I'm so sorry.
So tell me, how do we prepare for emergencies in Mississauga, and who's involved besides yourself?
Sure. So the way that we prepare is first understanding what our highest risks are. So we do what they call a HIRA. It's a hazard identification and risk assessment. So basically what we do is we look at what occurs in the area, the severity of it, and what the consequences are. And then based on that, we have a ranking system. And then we start planning with the most probable risk. The most probable risk that we are looking at right now is flooding. And so we have designed a residential guide to flood prevention and recovery that the City of Mississauga has developed this last year to give to our residents, because we're not only planning for ourselves and the corporation and how we respond to the incident, but we're also charged with making sure that the public is aware of what the risks are and to prepare themselves.
So you've given some examples of what you guys are working towards. How do you disseminate this information to people?
Well, we disseminate it through opportunities like Rogers is giving us today. We also do it through going to council with items like this that they can then disseminate to their constituents. We have a website, but the the best way to get information to the public is through someone they trust. If someone they trust tells them that they need to be prepared for any type of incident or a situation, then they tend to be more likely to prepare something. Some organizations take this type of information to the schools and try to get the youth to do these types of things, but we think it's more important to have adults to understand that you're not only responsible for yourself in a disaster or an emergency, but you're responsible for those children and for your family and for other things. So when you don't prepare, you cause a greater effect on the emergency services, because not only are we trying to do what we need to do to get something back to normal, but we're also having to look out for the individual who didn't prepare. So there's a combination of it working together, but we always say a resilient community is one that's working together toward resiliency.
I couldn't agree more. But if I'm a senior living at home,
Yes.
and I may have some physical disability or maybe just poor mobility, how do I participate? How do I get involved? How do I plan for emergencies?
Well, as you said, the first thing you've identified is that you have some issues, whether they're mobility or whatever the situation is, that now you really need to plan, because you need to know who are you going to call, where are you going to go, and how long can you stay there. So in some cases, seniors make arrangements with home health care services so that their needs are met through that system. In my past, we've even had registries where people could register to say, I will need help evacuating if there is an evacuation. And again, that is something that they can do through their home health or through making sure that their friends and family know that I'm going to need help evacuating. Some seniors will just let the landlord know, so that if the building is evacuated, the landlord knows that I have 5 people in this building that are going to need special help evacuating. So there's all kinds of ways to do it. The most important thing is to just get started. You'll figure it out as, running through your mind. What if, when you see a situation on TV, is asking yourself, what would I do in this situation? Where would I go? Where could I stay? How would I get my medications? How would I get cash? Because if the power's out and the ATMs are down, those are things you need to think about. I can't get fuel. And again, most of our vulnerable population, which is what we have to plan for specifically, won't have access to those things. So
And I'm glad you touched on the medication, because I have yet to encounter a client when I ask, do you have backup medication in case something was to happen and all the medication that you have here is destroyed? I have yet to hear someone say, yeah, I have a backup plan for that. So what do you suggest?
In those cases, when you have noticed that an incident is about to happen, so let's say we're going to get a really bad situation where we're expecting for the power to be out and an ice storm or something like that, then the seniors and people on medications that need their medications and can't go days without it needs to go ahead and go into the pharmacy and talk to the pharmacist or talk to their doctor about needing to make sure that they have plenty of medication for that duration of time. Most times, if you are about to run low or you're about to run out, people are pretty good about making sure that they get back in to get their prescriptions refilled. Just do that in a timely manner before an incident. If you don't know that an incident's coming, then it's a little bit more difficult, and in that case you may want to have a little bit stored or put back. But in most cases, prescription drugs have a regimen of taking them, and so it's very hard for people to actually hold an extra bit in case of an incident. So I would just say watch for a planned event, and if you see something coming, make sure you
prepare for
it.
So if I'm not a senior, but I'm caring for a senior, perhaps my parents don't have the capacity to prepare for themselves, as a general public, how do we prepare for it? And I know you brought a lot of things with you.
I did.
So this is something that we can put together?
Yes, actually, it's interesting that you say that, because I am in that world right now where I'm taking care of my elderly parents. who want to stay at home, and they live in Tennessee. So my sisters are doing most of the care for them, but I'm helping them on the preparedness side. So I've put a NOAA radio in their home, which is something everyone can have here, and it's just a weather radio, so that you can get special alerts. I've signed up my family for all the alerts that they can get through their iPhone or through their email. And in fact, you can do that right here in Ontario, so that you can be signed up as a family member who gives care to a senior, so you'll get the alert right away that there's an impending weather situation coming or whatever. So that gives you more time to then go in to help them. We've also made sure that, like you said, their medications are all marked, and they're all in specific containers, so that if they needed to evacuate, they would simply grab the container and go. We have the 72-hour kit, which I've put one together for each of my parents, as well as...
Do you want to sort of just highlight some of the items that you think would be critical?
Sure.
In a minute or less?
Yes, I will try. And if I don't get it all in, there is an emergency preparedness guide for seniors and people with disabilities, so you're more than welcome to that. There's also lots of information on the websites about the 72-hour kit, but the big thing you want to make sure that you have is water, any types of canned food, can opener. Make sure that you have your prescription drugs with you, so they do have, and this is a kit through the Canadian Red Cross, and a flashlight that you can crank. You got your first aid kit, and we all know duct tape saves everything, so you can do anything with duct tape. Candles with matches. And then we also have a little guide here, what to do in the first 72 hours. So these are available, and what you put in them is totally up to you, but it's good to have and put in a safe place.
Well, in a previous life, I've done emergency planning, so I know how challenging it can be. But thank you for being on our show and bringing some valuable information to our viewers.
Great. Thank you so much for having me.
We'll be right back. Thank you for watching another episode of About Seniors Talk TV. I would like to personally thank my guests, Susan Hyatt of Silver Sherpa and Teresa Burgess-Oglilvie, for sharing their knowledge and experience. You can learn more by contacting Silver Sherpa at www.silversherpa.net. Likewise, you can also learn more about emergency management by contacting Mississauga.ca. That's www.mississauga.ca. If you have a topic you'd like us to cover on this show, please let me know at volivera@inrcareservices.com. Thank you for watching.